Good day, viewers. Welcome to another edition of Health and Wellness, reaching you on Leadership Television. We want to apologize for being away last week. We were not available, but here we are now. We are going to do justice to this program today. And on the topic today, we are going to be talking about brain drain of Nigerian doctors and its impact on Nigeria's health sector. My name is Winifred Ugbebo, and with me in the studio is Patience Ihejirika.
Good afternoon, viewers.
Yes, we are back to discuss health and wellness. Thank you so much, viewers. Well, our guest doctor today that we are supposed to be having is unavoidably absent, and in his case, we are going to be doing justice to that. And of course, next programs we are going to be bringing doctors to talk more on it, because it's an issue that is really biting hard on Nigeria's health sector. We are looking at a situation whereby WHO said the parameter for treatment is supposed to be 400 doctors to a patient, and now here we have a doctor to 6,400 patients. So how are we going to cope? And compounded is the fact that Nigerian doctors are leaving the country in droves. 3 months ago, we carried a story that at Eaton or Transport, we saw Nigerian doctors doing interview for
Saudi Arabia.
Yes, to Saudi Arabia
to
travel. That was
last year.
Last year. Okay, last year. I thought it was 3 months ago. And there was a story that actually trended and made the news headlines. So where are we? It's an issue that's always being talked about, that's always been on public discourse. The fact that Nigerian doctors, though it's not even enough, but at the end of the day, the few ones that we have are leaving the country. Also, last month too, University College Hospital Ibadan also raised the alarm that they've had about 600 doctors
resigning from the institution.
Yes, and went abroad, and up to now they are not able to fill the spaces left by these doctors because of bureaucracy. We all know what it takes to fill vacancies in Nigerian not just health sector alone, in fact everywhere in all the NDAs. So like you were saying.
Yes, was it just last week here, the Medical Consultants Association of Nigeria,
Yes.
They had a program last week, and they said Nigeria produces about 4,000 doctors annually. And out of these numbers, the country ends up retaining only 30%.
But just 4,000 patients. But what about universities? At least, if I recall, Nigeria has how many universities till now? And most of these universities has a medical and health sciences
even private
department. And even not to talk of private universities. So how come it's just only 4,000 doctors that are produced annually? That is poor.
That's on that aspect of the
Yes, it is.
But then we are advocating that if the country can have more medical schools, so instead of producing 4,000 annually, we can bring it up to like 8,000, then 12,000. So even if we end up losing about 20% to outside the country, we still have to retain.
But you know, one thing, it just occurred to me as we are talking patients that it's not just producing alone, it's the retention, because we still have some medical doctors that don't have jobs. It's not as if these 4,000 now they employ them. No, they don't still employ them. Because I had a situation then many years ago that a doctor friend of mine, before he could get employment, it took him like this. Finally, after how many years, luckily for him, he was running a pharmacy. Then it's just to, by the side and to get by. But finally, he was able to secure appointment in Nigerian Health Ministry, where he currently is. But it took him years before he could get appointments to engage himself. And I even up till now, I laugh at him that, a doctor that is working as a civil servant, when you're supposed to be in the hospital,
I think that's one of the issues.
Fine.
That's one of the issues. Because doctors will tell you what they go through, they go to pass down to get that mark. to admit them as medical students in school, and they end up spending 6 years in school, they buy expensive books in school, pay high fee, and then they come out looking for jobs. And now so many of them are still roaming the street, even though we are saying they are
That is
leaving
what
the
I'm
country.
saying. That even the 4,000 that they say graduates every year,
There are
they
still
are
many
not. None of
that
them are not engaged.
jobs. And the ones
Exactly.
working in private hospitals, they are being
Yes.
paid peanuts.
Peanuts. Oh yes.
So this are part of the things encouraging this immigration of
Yes.
medical doctors. I won't advise that government do something urgently about this replacement.
But most of them actually, there's a saying that somebody that actually wants to, that is about to die, there's actually nothing you can do about it to save the person. Because it's a situation whereby these doctors have already had their sight that yes, they are going to immigrate. So there's nothing most times what you can do, what you do for them that will make them change their mind. Because given the prevailing economic situation, the realities on ground, the safety. Like for instance, I read that part of the reason was the poor remuneration, they have not
Insecurity.
paid, and they now cited insecurity. And I asked myself, when did this insecurity start? That insecurity is now an issue. Insecurity was not there
One part
before.
of the problem.
Yes, was not part of the problem. So they just now added insecurity. And truly, they have every cause to complain because we've seen that in most of the states of the federation, they are being kidnapped or ransom. If it's not maybe it's somewhere in the southwest, you are saying somewhere in the south. Yes, and southeast too. It's terrible. I think where it's not so rampant, I think it's mainly in the north. Yes, that you don't have such situation. But the situation is actually a critical one because doctors are becoming endangered species as well in the hands of these kidnappers and gunmen. So we don't really know. We talked about poor funding because that is one of the reasons too. They also cite they talk about poor funding of the health
And you know,
sector.
before now, our problem with this sector was strike
Yes,
because of this
poor funding.
poor funding. So now I think
Remuneration.
with this new with this trend of traveling now, strike will no longer be an issue. Instead of going on strike, right think of leaving the country. Everybody
Yes.
wants to jackpot. That's the language that's really now. So
Jackpot.
now it's not only about doctors, even pharmacists and nurses.
Yes.
So you see a young girl now studying nursing in school, and you're like, oh, you soon graduate. No, I'm planning to leave the country.
Yes. And it's very nursing. Nursing sells so well in outside in the Western world. We see some Nigerians who even had different fees. Once they emigrate or they go to all these Western countries, the next is to go and start studying nursing.
And you know the role that a nurse is playing in hospitals. So as in, I'm just like imagine if this trend continues, what will before us in coming
In
years?
the coming years.
You understand?
We cannot even predict it. And when we talked about not enough doctors, do you see that is why Nigeria's health goals also is compounded because you have a situation whereby most of these doctors, our primary healthcare centers, they're in the rural areas. They decline, they don't go there. They just don't want to go there. Many doctors want to be in the urban sector offering services, and which is also a big problem to Nigeria's health sector.
And primary health care centers, most times you will find nurses there. Now that nurses are also leaving the country, very soon we'll not have any
You don't even have nurses.
to manage
You don't
these
even have
facilities.
any- Exactly.
So I think it's something the government really needs to do something about urgently.
Patients, from what I can remember, from time immemorial, every government has, we address the health sector. We are going to do this, we are going to do that. Don't forget that one of the reasons the present administration headed by President Muhammad Buhari said was that even when he was head of state that time, that Nigeria's hospitals are not worse off. They are primarily like, how did they call it then? Consulting, they are mere consulting clinics. That was how he described Nigeria's hospitals. But years down the line, and now currently almost 8 years on the saddle, have things changed. And the president actually seeks for medical treatment outside
Outside
Nigeria. We even asked recently during the presidential debate, a presidential aspirant of one of the leading parties, when asked about medical tourism, he said no, that he cannot trust his faith or his life in the hands of Nigerian doctors, that he's not promising to stop medical tourism, that he will go when he's voted into office.
So that's one of the reasons they don't
It's really sad.
they don't see this situation as something that is urgent because they are not directly affected.
Oh yes.
Their families, even they don't go out of the country, they have money to patronize private hospitals. So it's the common man that feels the impact most.
It is the common one. Those are even the middle ones. If they would rather go and start begging money to go for treatment
Medical
outside
tourism,
exactly than to go and go to the Nigerian hospitals for whatever. Anyway, we have to go on a break. When we come back, we'll have more discussion on that topic. Don't go away, viewers. Stay tuned.
For sponsorship and advert placements, please contact 080-3688-6158. Last Word Leadership Podcast Studio. You have the last word.
Welcome back, viewers. In case you're just joining us, this is Health and Wellness for Leadership TV. We are still on the topic brain drain and its impact on the Nigeria economy. So before we went on break, we were talking about the impact of brain drain in Nigeria. So we were talking about medical tourism and the need for Nigeria government to see the needs, urgent needs to replace doctors that live in a country in drove. That was our discussion. I don't know if you were saying something.
Yes, I was. We're talking about the impact. The impact is actually is going to be devastating, or is rather, it's already we are feeling the impact. It's devastating, But it's just that our political leaders, they are not really, they are just paying lip service to Nigerian sex sector, because time and time again we've had a government that will come in and say, oh, they are going to do this. Was it not in this administration that the first lady raised the alarm that there was not even
Yes,
paracetamol in the state clinic? I mean, it caused this it called for concern. If it's the state clinic where the president and his wife, they are supposed to visit, and other paraphernalia of office, and yet they don't have that basic.
They better imagine what is going on at primary health care level.
Exactly. So that's to tell you what the other hospitals are suffering. It's basically a sorry situation, because over time, the Nigerian government has not been able to do something to live up to its expectations. Of course, we can understand that, yes, there are limits, because health is on the conclusive list, and you have a situation whereby the federal government is in charge of this. The federal government is in charge of all tertiary hospitals. Yes, federal government is in charge, in case you don't know, because many people have the erroneous impression that, oh, the federal government runs all the hospitals in Nigeria, across the country. No, it's not so true. Federal government is in charge of all these tertiary, we call it tertiary health institutions. We're talking about
Teaching hospitals, for
yes,
instance,
teaching
like we have
hospitals,
a federal medical center in Abuja,
National Hospital. Yes, under presidency, we have a federal medical center,
UBCH,
things like that. Yes, all these teaching hospitals. Why state governments on its own part are in charge of secondary,
secondary and primary,
tertiary, I say tertiary, secondary level of health institution? Talk about general hospitals. Like in FCT, you have the FCT minister in charge of all these general hospitals across different
area councils.
We have Metama, we have Asukuri, we have Wuse, just like that. This is the same way in states. State governments are in charge of general hospitals within their domain. You understand? While primary health care centers are actually under the domain of local government. Local government chairman, they're supposed to be in charge of these primary health care centers. And primary health care centers is supposed to be the primary first point of call, that when you are sick, you're supposed to go to primary health care. Unfortunately, all those tiers of treatment, these tiers of treatment no longer exist in Nigeria. You see that somebody that is sick that can afford it will just first of all go straight
National hospital,
exactly, to be treated. But it's so bad that we are talking about the impact of doctors' immigration on Nigerian sex sector. It's so bad that our health sector is so bad that you still find situation whereby Nigeria is still recording a high volume of maternal mortality. And what is even more worrisome is that most of these maternal mortality rates that are recorded or being recorded, they take place in our highest level of care, and that is tertiary health institutions, that is specialist hospital, teaching hospital, which is not supposed to be, because pregnancy or delivery is supposed to be taken at the lowest level
Primary
of care,
health
and that is the primary health care centers. So what does that tell you? It shows that there's so much to be done. There's so much to revamping that's supposed to be done in Nigerian health sector, because a situation whereby a pregnant woman that just wants to deliver is still dying at a highest level of care, it shows that no, that we need to put our health sector in order.
You know, even with the basic health provision fund that was meant to at least improve the services in primary healthcare centers. For instance, I went to a community in the Gwagwalada area council. So that community have a primary healthcare center, and they're able to access this fund.
Yes.
Yeah, then the people in that community, they give them a card. If you have that card, you can access a free care in that primary healthcare center. But guess what? The primary healthcare center closes by 4 p.m.
So anyone that any person that
there's an
comes after
emergency,
4 p.m., they are not going to be
the
attended
nearest
to.
place they can go to is Gogolada. You understand? So we're like, what if a woman that wants to go to bed?
Go to bed.
They
And
say-
most times, delivery is always in the
At
night.
night. But they said that whenever anything happens beyond 4 p.m.,
They are on their own.
they have to be on their own. Yes, they are on their own. So we're like, why? Why? They said because of insecurity. Because the community is far inside, so they fear of being attacked at night. That's the reason why they close by 4 p.m.
Patience, what you just said now, sorry to butt in, is the situation I also experienced in Edo State, going to Edo State. And there's this primary health care center that is just built behind a cemetery ground. So these women come, to access care. But in the night, the place is deserted. And what happens when the woman wants to deliver? They don't go there to deliver. So what is the essence of citing a primary health care center close to? It's just beside, it shares a boundary with a cemetery.
This same primary health care center, there's no water. So then we're not asking how people defecate in this environment. Then you see the problem still recycling, because when people go there to the openly, when it rains, issue of diarrhea and cholera comes in, and then there are no experts on ground to attend to them. In fact, people still, even though they have this, at least they are privileged to have this funds, they still end up paying out of pocket. Most of the time, because when there's nobody to attend to you at that point, where you could access free services, you end up going to a place where you go and pay out of pocket. So the problem is a very big problem.
It's always a circle, keeps revolving.
I don't really know how we'll get out of this, but I think our president, the minister of health presently, I don't think he has passion for health, if you ask me, because like,
we can see that, because most times he's not even there,
he doesn't care. He doesn't care. He speaks so carelessly about issues that have to do with human lives. Because recently, when he was asked about this, my immigration doctors, he was like, no. As in, from his response, he's not as bad as we think. That's what I can understand from him.
So he's not bothered about what the news is saying.
No, but like what he said was that yes, people are leaving the country, doctors are leaving the country. Yes, we know, but we still have more. We're producing more doctors. If I can quote him, he said we produce about 2,000 doctors annually. So the ones leaving the country are not to that amount.
That is his own statistics.
So as far as it's concerned, we have enough doctors in the country.
That is sad. And it was the same thing with the Labour minister when medical doctors went to
we have enough doctors in the country.
It's really, really
so it's
sad.
because people have the money to patronize private hospitals. So they don't visit these general hospitals to see what poor Nigerians go through in these hospitals.
Even what you call common malaria, you see how many Nigerians are dying. Our children, women are dying from
just
malaria.
2 weeks ago, we had one community in FCT here. Primary care center in that community, they don't have drugs. It's an IDP camp. So we're asking the women. They say yes, so they have a nurse, but they don't have paracetamol in the primary care center. So what is the essence of having the primary care?
Exactly.
Something as little as paracetamol is not there. So you understand?
Because you're even talking about community. What about the state house clinic? That will just make sure that if the state house clinic doesn't have paracetamol, you expect one primary health care center in the remote community to have.
So I don't know if our government is setting donors, national donors, to come and start running our hospitals. Do you understand? It's a serious problem, honestly. It's a serious problem. We just pray we are able to get out of this, honestly, because with the problem in the world right now, with public health emergencies, I wonder how we'll be able to cope if, for instance, another problem before us. Because really we are not prepared.
Yes, we are not prepared. Just what you just said, patience, makes me to remember what somebody said. Said, no, that we should not be referring to ourselves as a developing country. We are not developing because we have remained stagnant over the years. That we just say we are not developed. And there's a difference between developing country and a country that is not just is stagnant,
Yes.
So it's really, really sad. It's a sorry situation. So I think let's move over to awareness. What are we discussing on awareness today?
Yeah, they say health is wealth.
Yes.
So it's good people know some things that you could avoid on your own. Yes. So I think today we're talking about the weather. Since the weather is very hot.
The weather is so hot. You won't believe that if there's lights anyway, not the days. Getting lights in the country is rare. It's a rare gift now. So I still put on the AC. Still put on all whatnot because the weather is unbearably hot.
That's for you that have AC. Imagine someone who does never have a fan in the house.
Most times when the current cannot carry it, I use fan. It's that bad. And even in the afternoon, the sun scorches your eyes. I don't leave home without my sunshade.
Yeah, I think from what I've read about how to avoid some problems from heat. It's like one, you drink water regularly.
Yes.
You take water regularly. Then you don't need to bathe with hot water.
Okay.
That's
like
hot
for
water.
many people. But I still have a neighbor that likes to bathe with hot water.
Even myself, I bathe with hot water.
Okay.
From what I read, that's when you bathe with hot water, you take anything hot. It makes you to dehydrate easily.
Okay.
So that's why they say you should take more of cold things, not so that the sun is hot, so let me take cold minerals. So take water. Rather, that's what the experts advise. You should not take cold water, so taking soda.
What about in the night? For some experts will say don't drink plenty of water before going to sleep.
Going to bed at night. I don't know much about that anyway. But I just think for your eyes, protect your eyes because the sun damages the eyes.
So and the skin too.
The skin too. I think that of skin mostly is for those that use
bleaching cream.
Bleaching cream.
Yes.
So if your skin is natural, if you use a cream that is not too harsh, so the sun will not really have much impact on your skin. From my own observation.
Yes.
But for those that are using cream that have some bleaching agents. So when it reacts to the sun with the sun, you see the impact on the person's skin.
Then some skin are badly damaged.
And then your face too. Then if you're able to use a sunshade, to reduce the effect of sun on your face. Then
maybe there's a cream, maybe some that has sunscreen that
people should be able to use on their faces to avoid the sun.
But you see how life goes. This sun that we are complaining about is what all those developed countries we welcome gladly. Yet here we are. Nigeria has not been able to manage its resources.
I think there are most of the things are just to have water. Take water regularly to avoid dehydration. To avoid dehydration, take water regularly during the heat period to avoid dehydration. Then, as much as you can, eat good food, practice a healthy lifestyle.
Okay.
You understand? Take fruits and vegetables. Then rest when necessary. Then, like you said, at night you don't take too much of water at night, but at least you're able to bathe with cold water, warm water at night. At least I think it will reduce the impact of the weather on your body. That's how we can go today.
Thank you so much.
Next week, same
so
time.
talk to our viewers.
Viewers, thank you for joining us today. Same time next week, we'll come with another topic, and hopefully by then we'll have an expert to join us on the topic.
Yes.
We love you, and we hope you hook up with us next week.
Yes.
Bye for now. Okay, I'm Patience Kedrika.
Bye.
Bye for now.
Thank you for watching. For sponsorship and advert placements, please contact 080-3688-6158. Last Word Leadership Podcast Studio. You have the last word.